Hello, everybody. My name is Graham Elwood, and you are watching The Political Vigilante. Do me a favor, hit the like button, hit the subscribe button. We just crossed over 74,000 subscribers, and that's with YouTube shutting us down because they don't want us talking about stuff, because MSNBC is not going to do a story about how Cuomo is shutting down hospitals. Look, he shut down so many hospitals in the last 10 years as the governor. So when the pandemic first hit, and it hit New York the hardest in the spring, that was one of the reasons that made it so hard, because he had already shut down all these hospitals. He wants to shut down even more now. This is the problem with our for-profit system. He wants to shut down a not-for-profit hospital in a black neighborhood. This pandemic is stealing black lives. This is from The Independent. It's just inconceivable to me. And this article came out the end of October, so this big second surge hadn't hit yet, and it was talking like we might have this second surge. But again, and look, they set up, a temporary hospital in New York City in the spring, right, when it was really bad in New York, and they didn't really send people there because the hospitals, the for-profit hospitals, like, well, if we send people to these free hospitals, we won't make a profit from them, and therefore some people died. So make no mistake, as awful as COVID is, it was exacerbated by our completely broken system. Well, it's broken for the regular Americans. It works perfectly for the 1%. More Brooklynites will die, healthcare workers say, of Cuomo's plan to close Kingsbrook Jewish Medical Center by the end of December, in a week. It's at the end of the workday, and Anila Nassim peeled off her jumpsuit, changed her shoes, and got in her car. Sometimes she sat and cried. Sometimes she just had to sit for a while and process the day in her head. She's a healthcare worker at this hospital. I've heard versions of this story from every healthcare worker in America. It's just brutal. I've seen interviews with people. I've talked to people that, friends I got friends who were, and it's just like every day they hold people's hands who've died. It is just brutal. Our frontline medical workers it is just brutal what they're having to go through. You don't think COVID is real? Talk to one of them. Go talk to a frontline healthcare worker and tell them, oh, it's not real. Go tell them. See how that shakes out. Go to a hospital yourself. So this is just, they've all had to see so much despair. And then, we're at a point now where 3,000 people a day are dying. Every day, a 9/11. We lost 3,000 people in 9/11. So every day, 9/11 is happening. During the height of the epidemic, she would walk past the cold storage trucks outside where dead bodies were kept. Hospital storerooms and offices were converted to patient rooms. In April, 5 Kingsbrook staff members died of the coronavirus. Hospital workers rallied outside for the hospital for personal protective equipment. And by the way, in California, in Los Angeles, and in Los Angeles County and Orange County, there's no ICU beds. It's done. It's full. They're all taken. I know somebody who was hiking with a friend of theirs, and this woman sprained her ankle really bad hiking. Took her to the hospital. They had to just drop her off because they couldn't be with her because you can't have people waiting. She sat in the ER for 3 hours. Nobody came and gave her medication, nothing, because everyone's maxed out dealing with COVID. So the people are like, oh, it's not real. This is the problem. All the ICU beds are maxed out. So you don't want to wear a mask, or you want to just hang out with your friends. This is what happens. This is what happens. So now you get in a bike accident, you trip and fall, you have a stroke, a heart attack, anything non-COVID related, any emergency, car accident, they don't have room for you. This is the problem. It's a problem right now in It's a problem in just about every state in America right now. And they want to close this because we're going to get into the story. And it's an in-depth article. I'll put the link in the show notes. Read the whole article. But spoiler alert, land developers want it. New York land developers. Oh, we could put condos and high rises there. We need hospitals. It's just we're still just grubbing for money. Don't care. By December 31st, the rest of the 163 medical surgery, 10 intensive care unit, and 10 Corona Care unit beds will be gone for good, even as the city faces a possible second wave of COVID-19 infections this winter. Well, that's already happening. That's already happening. This article was written 2 months ago. It's already happening. By closing this hospital before the second wave of the pandemic which has the possibility of being worse than the first. Governor Andrew Cuomo is working to ensure that even more Black Brooklynites will die. Because Kingsbrook serves a largely Caribbean, Black, and immigrant population. It's a safety net hospital, which means one that provides care regardless of a patient's ability to pay. So in this horrific capitalist nightmare that is the United States of America, there are a lot of hospitals that will not treat you if you don't have health insurance. That's why we have, I don't know what the number is, somewhere 30 to sometimes even 60,000 people a year die because they don't have health insurance. This is why you need to go to forcethevote.org. We need to force a vote for Medicare for all. We need to force this vote. We need to force this vote. So we don't, but the new stimulus bill has Medicare for all. Oh, no, it doesn't. It has $3.5 billion to countries like Israel and Senegal. And why are these countries getting aid? Oh, it's part of the original. We just folded in the regular budget for the, okay, well then why are these countries getting aid anyway? This is the regular budget for the, well then why are we paying for all of this? Why don't we have Medicare for all? Why are we giving other countries hundreds of millions and in some cases billions of dollars and we don't have free healthcare here? So then we shut down hospitals like this? Because this hospital, because it is a safety net hospital that provides care regardless of a patient's ability to pay, 90% of the people that come through use Medicare and Medicaid, right? Which reimburse at a rate below the actual cost of its services. And because Kingbrook has so few patients with private insurance, it cannot offset its costs. This, I want to make this really clear. When people tell you, oh, it's government-run healthcare, which is not what it is. It's socialist healthcare. It'll be a nightmare. All it is a payments. This is how Medicare currently works. You go to a hospital, whatever one you want to go to, you get treatment. They give you the bill. The government, Medicare, which is a government agency, comes in and says, we're not paying. We're paying a lot less. Here's the bill. We paid it. It's done. So when they say, oh, it's just going to cost $34 trillion, the current system costs $50 trillion. That's a $16 trillion loss for these poor for-profit hospitals. That's where they can charge you $300 for a prescription. They can charge you $2,500 for an MRI or something, like just preposterous numbers. That's why they pay both parties to block Medicare for all. That's why even the squad, AOC and the squad, are afraid to force the vote because they're going to lose all of their donor money from these big. I just explain what this is. Wow, how government run healthcare. Blah, 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 blah. No, it's just a payment system that the government just comes in and says, you can't charge that much. That's all. It's actually better healthcare because you can go to whatever doctor you want. You ever do the, oh, you can't go to this doctor. This doctor's not in network. I've had that. And then the doctor in my network's not great or they're far away or whatever. No, I could just go to whatever hospital I want. I mean, I can't now because they're all overrun with COVID. Some of these closures, including those of the St. Vincent's in West Village and Long Island College Hospital in Cobble Hill, two of the city's affluent neighborhoods, have become notorious as giveaways to politically connected luxury real estate developers. Oh. Hey, here's a hospital that could help people, especially in a pandemic, but just more hospitals. Isn't that just better for our society? Free healthcare, isn't that better for our society? I don't give a fuck. I want to build condos. Shut up. I'm a hedge fund manager. I'm a weasel. I'm a soulless weasel. Shut your mouth. I'm going to build whatever I want. I'm going to buy off politicians. I don't care if this hurts society because I don't give a fuck. That's how a developer thinks. That's how their capitalist rat brain thinks. They're like rats. They just eat like rats. They spread their vermin. They're rats. Hey, we should help people. Rat. Give me money. I want a big shiny thing. Get rid of that hospital so I can put condos up. Rat. Speaking of rats, Alexander Roft. What kind of name is that? Sounds like a rat name. A billionaire real estate developer, so rat, sits at the head of the board of directors at One Brooklyn Health, a not-for-profit corporation established in 2017 that owns Kingsbrook. Do you see how they operate? Do you see how the ruling class operates? This is why this, like, we don't want to force the vote. We got to wait till we get on a committee. They don't play fair. A billionaire gets himself on the board of directors, a billionaire developer gets himself on the board of directors of a non-for-profit hospital and goes, oh, now I can shut it down. Do you see how they work? So when AOC goes, oh, I don't want to do a performative act of forcing the vote. Yeah, we need performative acts. Performative acts rally people around us. Because look, you got to dig to some small New York independent online news source to find this story, because Rachel Maddow's not going to scream about this. Cuomo's brother ain't going to scream about this. But are any of these idiots, Chuck Todd or any of them, Wolf Blitzer, they just screaming this is we're in the middle of a pandemic, we're shutting down hospitals, a billionaire developer? No. This is how corrupt the system is. And you want to play nice and wait till the midterms and wait till we get enough people in a committee and pay attention. Real grassroots organizers don't. What's your step 2? That's so corrupt. That is a billionaire developer. Why is a billionaire on a and I'm sure he does all this philanthropy and he has big fundraisers. They're all just tax write-off bullshit. All that philanthropy is the gateway to power. These filthy billionaires know this. So I'm on the board of this hospital. It looks good, but deep, this is how I maneuver. This is how the 1% billionaire ruling class. You know who else hung out in New York and did shit like this? Donald Trump, Jeffrey Epstein. That's where they operate. That's where they operate. It raises questions about whether the nature of this project is about making money for some people or whether it's about truly meeting public health and community needs, says Kingsbrook nurse Julie Keefe. These nurses and doctors, these frontline workers got into this for noble reasons, most of them, I would imagine, to help people. I'm a billionaire developer. So what's this guy going to do? Get on his private jet and laugh about how he shut down a hospital that helps low-income people in the middle of a pandemic? I shut that down and I put up a big shopping mall. Why can't that cocksucker get COVID? Oh, by the way, this is a map of all the states where foreclosures and evictions are coming. Oh, by the way, so we're going to shut down hospitals. We have the highest death rate of any country, and we're going to shut down a hospital so some billionaire can. The capitalism in this country is so just out of control. And then there's going to be someone in the comment section of this video or on social media defending this billionaire asshole. Yeah, but Graham, it's his right. What? They're just vampires. They're ghouls.
We turn now to that $350 billion fund to help small businesses and its workers get through the shutdown.
It will be up to Congress to restock it.
But Democrats blocking that move this morning.
They asked for $250 billion in 48 hours. I said, well, I don't think so.
That's the last filthy stimulus. Now we got $600. We got $600 coming if we're lucky. Trump says he wants 2,000 people. They said that we might get $2,000. I don't care what Trump's motives are. If everybody gets $2,000, good. This is why we need Medicare for all. This is why we need Medicare for all. This is why we need to go to forcethevote.org. Go to forcethevote.org, January 3rd. Tell the progressives in Congress, tell every Democrat in Congress, you better withhold your vote from Nancy Pelosi. We want Medicare for all. We need it now. And stop falling for this shit. Oh, Cuomo's he's such a hero. And oh, he's fighting Trump. He's been shutting down hospitals for 10 years, man. 10 years. There's a lot of blood on his hands. Don't get so angry. You have angry issues. People are dying because the richest country in the world doesn't care. Any rich people been denied health care? Any rich people die because they didn't have health insurance? Oh, no. Richest country in the history of the world. We could have Medicare for all, folks. We could have all these things. We don't need to give hundreds of millions and billions of dollars to other countries and other nonsense and fund defense contracts. $740 billion We just approved the war budget, the new war budget, $740 billion. How we can't pay for Medicare for all? There's some money. Unbelievable, man. Unbelievable. So get loud. If you live in New York, flood Cuomo's office. Call him and say, no, don't shut this down. Keep these hospitals open. Hold him accountable. Hold him accountable. Call Governor Cuomo, the New York State Governor Cuomo, and say, stop shutting these hospitals down. Call them all right now and go to forcethevote.org and sign your signature. We need millions of signatures on this to show these politicians, these Democrats, these so-called progressives, that we are going to, then if they don't withhold the vote, we're going to withhold our vote. Vote Any Blue Will Do is a sickness. It is a virus that allows this type of corruption to continue. It's a sickness. Thanks for watching the show, everybody. Like, share, subscribe. Right? You're making Gotham great again. Shave your knuckles for justice. Connect the dots to find the truth. Boom. Thanks for watching, everybody. Please hit the like button, the subscribe button. Go to patreon.com/Graham Elwood and rockfin.com/Graham Elwood, where you can support the show. Also, I have a Bitcoin wallet, a Bitcoin Cash wallet, and an Ethereum wallet in the show notes. We're taking cryptocurrency. I have a Coinbase affiliation link. We're going to be getting on some other exchanges. So that's how you support the show. Make sure you hit the subscribe button. YouTube is unsubscribing us at an alarming rate. I have a PayPal button at GrahamElwood.com. I even have a Venmo at Graham-Elwood. There's a lot of ways to support our show. We are getting crushed by YouTube. We've dipped under 73,000 subscribers because of YouTube. Thanks for supporting what we do.